Are you tired of feeling like your lungs have gone on vacation without you? And maybe it's asthma or COVID long haul or just that constant ugh feeling when you're trying to take a deep breath and no oxygen seems to be getting into your system. Buckle up, because we're about to dive into a little known lung hack that could change everything. You want to meet the Infraspinatus respiratory reflex, or the IRR. Now, I know that's a mouthful, but it has the potential to turn around your breathless struggles. It was discovered by Dr. Philibert, a medical doctor in Louisiana, and the technique boasts an 80% success rate. And I've seen it literally do the same thing for 20 years inside of the West Clinic. Now, what's amazing about it is most doctors don't even know about it. So if you're looking for a way to breathe a little bit easier, stick around. You don't want to miss this one. All right, you guys, let's start talking about this really important organ called your lungs. It's kind of a big deal. If you don't get oxygen into your system in the right way, you know what happens is you will start to degenerate. You're going to be creating lactic acid. You're going to be creating pyruvate, all these other waste products, but also you're going to run out of energy. You're going to run out of vitality. It really is the thief of life. And so go with me on a journey here about lungs and breathing. And let's talk about, asthma, but we're going to hit all lung conditions because this really helps with COPD, with chronic obstructive pulmonary disease. It works on asthma, exercise-induced asthma. And this disorder of the respiratory system, what it does is it is so important for, again, oxygen, and it has to be that final electron acceptor of all of these cellular processes. So many diseases are prevented. And not only that, but the ability to live life without coughing and wheezing and shortness of breath, it's amazing. If it gets really bad with other organ systems, you can have what's called cardiac asthma, where the fluid builds up around the lungs. It can be a complication of congestive heart failure. But let's start talking about asthma, because what it is it literally decreases your body's ability to get oxygen into the system. And then what happens is we can have these triggers that cause it. Food allergies, exercise-induced asthma. Infections are a huge player. We're going to talk about some studies that come out of Europe that literally show if you help the body's immune system to work right, what happens is it improves and it cleans up that respiratory reflex. Now, there can be some problems with medical procedures with children under 8, and a lot of problems that you see with kids. What happens is it leads to pediatric emergency room visits. When your kids can't breathe, it's a big deal. So let me introduce you to the infraspinatus respiratory reflex and how this really, really helps with breathing conditions. I'm Dr. West. I'm a chiropractic physician. I also have a naturopathic degree. I'm a fellow of the International Academy of Medical Acupuncture, and I have had 25 years of clinical experience. And I want to give some acknowledgments to not only Dr. Philibert, but the other doctors that I've learned so much from this, like Dr. Schallenberger, Dr. Hicks, Dr. Klinghardt, Dr. Harris. And let me tell you a little bit about this IRR treatment. Dr. Philibert noticed that virtually with 100% of his patients with asthma, they had really tight, tender muscles right along the spine of the scapula, right underneath it, therefore infraspinatus. And when Dr. Philibert figured out wow, there's this muscle, it shows a common nerve kind of connection with the lungs. I wonder if you can reset that nerve memory idea. Now, go with me on this. We have nerve memory that happens all of the time. And unfortunately, in traditional Western medicine, it's highly neglected and not used, or not, evaluated or considered. Let me give you a couple common examples. I work a lot with rodeo guys, and every once in a while, I'll have a rodeo guy come into the office, and he'll be out practicing roping. He'll get his rope caught around the steer, and then he got cut around the finger, and then the steer takes off, and it pulls his finger right off. They'll come into the office and say, "Man, my finger is killing me." And what is that? We call that phantom limb syndrome, So it's not even attached to the body, but the nervous system is saying, I hurt, I hurt, I hurt, I hurt. It's not just phantom limb syndrome. Like we can have it if you have your gallbladder removed and phantom gallbladder syndrome, or what else we can do or recognize, it can be after an infection. So unfortunately, there's a condition called post-herpetic neuralgia that can happen after infection of the nerves where you get shingles. Infection goes away, but the nerve still hurts. Well, it's kind of the same idea. Like if you're not breathing right, the nervous system thinks it's normal to have this, organ dysfunction or this long shortness of breath. And so it doesn't work very well. So Dr. Philbert figured out that not only how to reset this, but he taught it to a lot of physicians. I mean, it sounds like a lot. I mean, there's, I think, about 1 million physicians in the or healthcare providers. He taught it to a couple hundred. I don't think he's around anymore. But what he found was when he taught this and you treated that muscle, it literally helped to reset the nerve. So the automatic nervous system, or the autonomic nervous system, it is our autopilot for breathing, heart rate, perspiration, dilation and constriction of the blood vessels. Like it does its thing like this. And once he discovered this nerve impulse that can be irritated, he found that it can become a broadcasting station of sorts, sending distress signals to the paraspinal autonomic ganglia. So those are the nerves basically that come out around comes out of the spinal cord and innervates the muscles and the organs and the tissues on the front and the backside of the spinal cord. And he found that there was a disruption of this process. You can look at the illustration up here. We have this system that controls the inside, but we can influence it from the skin. Now, the brain, the nerves, and the skin all come from the same developmental layer. So when you're created, we have what's called the endoderm and the mesoderm and the ectoderm. Well, in that ectoderm, what happens is the skin over the muscles and the organs have a huge impact. Like you can influence that. They call that segmental therapy. And there's this amazing German technique called neural therapy that describes all that. That's a huge part of the success stories that we have inside the office. Like we have literally over 1,000 patient success stories, and all of them have this neural therapy component. Well, when we apply that to the lungs, what happens is he found that there was this tightness in this muscle that regulates the airflow into our lungs, and it causes chest tightness, wheezing, cough, difficult breathing. Found that prescription therapy sometimes can, maintain people. We give people steroids and it dilates the vessels. And then unfortunately, what can happen with steroids is it can have some unwanted side effects. And what he found out with this IRR therapy is that if we reduce the tenderness and the irritated muscle, what happened is it improved respiratory conditions. There's a specific medicine that he used. It was a glycolized ester of paraminobenzoic acid, or PABA. And what he found was injecting this, which he called Procaine, into that muscle, it would get it to reset. The duration of the anesthetic, like it can affect the muscles maybe up to 20 minutes. I mean, this is a real mild anesthetic, but there are so many pharmacological effects of this anesthetic in resetting the autonomic nervous system. And so he found in a clinical trial study of over 4,000 asthmatic patients that in 4 out of 5, there was substantial improvement in 80 to 85% of them. And additionally, their back started feeling better. Their shoulders started feeling better. And he was the first one that made this connection of, there's this nerve that goes to the infraspinatus muscle. And he hypothesized that part of that reflex arc part went to the lungs. And 50% of those in that study literally said, hey, my condition has resolved, or we're not supposed to use the CURE word, and that it just really, really helped them. So he also found out that there was some triggers involved that you could have, there's other chronic respiratory problems that can be associated, with not healing right from pneumonia or chronic bronchitis, emphysema. But there's some really neat ways to reset this reflex and reset the muscles. And so literally this is one of the examples of someone getting assessed for this and looking at having them lay on their stomach, putting their arm over here, palpating underneath that spine of the scapula over the infraspinatus muscle. There's the muscle groups that's associated with it right there. And then what happened is the attachment from that goes from the spine of the scapula over and literally becomes a part of the rotator cuff process. He also recognized that all this area is highly innervated, and that by combining some manipulative therapy, this is what we do in our office, some manipulative therapy, some soft tissue release techniques, some chiropractic adjustments, do both of those, I think we get amazing clinical outcomes. And it's not just me saying it. You can see it on our YouTube channel, and you can see it on our patient success blog. And so when we're evaluating people, we palpate the infraspinatus muscle. And then what we do is literally we kind of make a mental map. Here's the muscle. And then you take that special, paraminobenzoic acid, just a little needle, and you go to those spots. And a lot of times what will happen is you'll see those release in that process. After the treatment, sometimes people feel their arms are a little bit heavy. Usually takes anywhere from 2 to 3, but it's 3 to 5 treatments. I've had some people that respond immediately, and then they say, look, I don't need any more treatments. And so I have had that happen, but usually it takes a consistent couple of resets for that. And then cleaning up all the other stuff, using manipulative therapy, acupuncture, some homeopathic considerations, some milk thistle, some stinging nettle, magnesium, IV vitamin C, and this mineral called molybdenum. Now, not a lot of doctors know about what molybdenum does, but it has amazing therapeutic effects on lung therapy. And I have the little note up here on this that, medical prescription, I have it starred up here. And it's not that there isn't a time and place for it, but most people are coming and looking for a different type of treatment than steroid therapy or a puffer and an inhaler. So you can see these on our website, on our success story. Asthma is not a prescription deficiency disease. If we do the workup where we're looking at the blood and we're wanting to balance those out, eliminating food allergies, checking for molds, checking for fungus, looking for environmental impacts, and we put the body back in balance, I've seen 25 years of people being able to function without asthma and exercise-induced asthma. I've seen incredible outcomes for lung conditions, COPD, emphysema, and you don't turn that around, but you can make it a lot better for everyone. That's really what I wanted to talk about. We have a 108-year history in the clinic about asthma and breathing conditions. If you would like to work with us, you want a free consult review with my team, just go over to americashealer.com. Don't forget to like and subscribe. I'll see you guys on the next one. Dr. Jason West signing out.